Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about the policy of integrated and coordinated care of all patients. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with follow and likes. This policy is applied to all medical, clinical, nursing, and supportive departments of the hospital. The purpose of this policy is 1. To result in efficient care processes and more effective use of human and other resources. 2. Collaborative patient care with likelihood of better patient outcomes. Definitions. Care plan refer to a written document stating the future strategies and measurable goals and objectives to manage patients on the basis of his or her assessment needs. Policy statement. Number 1. There is a process to integrate and to coordinate the care provided to each patient. Number 2. The care provided to each patient is planned and written in the patient's record. Number 3. Those permitted to write patient orders write the order in the patient record in a uniform location. Number 4. Interventions and procedures performed are written into the patient's record. And number 5. Patients and families are informed about the outcomes of care and treatment, including unanticipated outcomes. Responsibilities. Number 1. Interdisciplinary care team. Treating physician, staff nurse, patient educator, social worker, and clinical dietitian. Treating physician and staff nurse will initiate data collection, assessment, and planning as early as possible in the patient's continuum of care, prior to admission in the physician's office in polyclinic. The initial care plan must be completed within 24 hours of admission in the general ward, and no later than 8 hours post-admission in the acute care setting. The care planning process is an interdisciplinary collaborative process and is integrated into the patient's care across the continuum. Planning includes patient, family, significant others, and appropriate health care team members, as well as necessary support of community services. Discharge planning, physical progress notes, daily orders, nursing notes, and strictness to clinical guidelines and pathways for revising plan of care facilitate appropriate communication of information among interdisciplinary team members across the continuum of care. Number 2. Treating physician. Based on the results of initial physical assessment, The treating physician will formulate a medical care plan. The plan will be documented in the prescribed form for each inpatient or outpatient departments and attached in the medical record, highlighting the following: initial diagnosis, expected length of stay, main lines of treatment or surgical care, thus say drug categories, procedural interventions intended to manage the case, and measurable elements for improvements, at least one measurable goal that will be used as an indicator of plan success and readiness of patient for discharge. The medical care plan is revised at the time of reassessment and follow-up according to the patient's condition and progress. Number 3, staff nurse. Based on the results of nursing assessment, the staff nurse will formulate the nursing care plan. The plan will be documented in the prescribed form, whether initial or modified, and attached in the appropriate section of the medical record. Number 4, clinical dietitian. Based on the results of the nutritional screening done by the treating physician or staff nurse, the clinical dietitian will make detailed assessment to formulate a nutritional care plan for nutrition therapy within 12 hours of receiving referral from the concerned department. The nutritional care plan will be formulated in collaboration with other disciplines such as physicians, nurses, pharmacists, social workers, and kitchen staff. All patients assessed as having moderate to high nutritional risk will have a care plan. The only exception to this will be the patient of good nutrition status with good oral intake. The nutritional care plan must be documented with clear goals and measurable objectives and appropriate interventions individualized for each patient needs. The plan for nutrition therapy is revised at the time of reassessment according to the patient's condition and progress during follow-up. Number 5, physiotherapist. Based on the results of the functional screening done by the treating physician, the physiotherapist will assess the patient in detail and document a physiotherapy care plan within 24 hours of the receiving referral from the concerned department. Procedures. Number 1, care planning is integrated and coordinated among settings, departments, and services. Number 2, care delivery is integrated and coordinated among settings, departments, and services. Number 3, the results of or conclusions of any patient care team meeting or other collaborative discussions are written in the patient's record. Number 4, the care for each patient is planned by the responsible physician, nurse, and other health professionals within 24 hours of admission as an inpatient. Number 5, the planned care is individualized and based on the patient's initial assessment data. Number 6, the planned care is documented in the record in the form of measurable progress goals. Number 7, the anticipated progress goals is updated or revised as appropriate based on the reassessment of the patient by the healthcare practitioners. Number 8, the care planned for each patient is reviewed and verified by the responsible physician with a notation in the progress notes. Number 9, the planned care is provided. And number 10, the care provided for each patient is written in the patient's record by the health professional providing the care. Number 11, orders are written when required and follow organization policy. And number 12, diagnostic imaging and clinical laboratory tests orders include a clinical indication and rationale when required for interpretation. Number 13, only those permitted to write orders do so. Number 14, orders are found in uniform location in the patient record. Number 15, interventions and procedures performed are written into the patient's record. Number 16, the results of procedures performed are written into the patient's record. Number 17, patients and families are informed about the outcomes of their care and treatment. And number 18, patients and families are informed about any unanticipated outcomes of their care and treatment. We have 3 attachments as examples of the documentation forms needed. 1. Patient care plan form. 2. Nursing care plan form. And 3. Dialysis patient care plan form. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.